Please join me in welcoming Donna Wilson.
Good morning, graduates, parents, friends of graduates. I see you here with your balloons and flowers, honored guests and faculty. I'm really excited to be here today. I'm very honored to have been asked. As a member of BCIT's foundation board, I'm thrilled to see that this great institution has yet again delivered some very smart, talented health leaders. That's exciting for me. So those of you I want to say a thank you to are the parents, the partners, the friends that have supported these graduates through their studies, through those nights that they didn't really want to study and you made sure they did. A big thank you. Thank you very much for that. You have successfully made ready an individual who will take our healthcare system forward through the biggest technology-enabled changes our system will have experienced to date. We need these graduates. We need all of them. My day job, as you've heard, is a senior executive with the Provincial Health Services Authority. It enables me to live inside the world of health delivery and diagnostics. I suggest that each graduate in this room buckle up because you're in for a big ride. So imagine the world without your smartphone. Normally I would not bring this up for a speech, but this little phone here has changed our world. Think about how it impacts you right now. Your choice for the best restaurant on a Friday night would be limited if you didn't have it. You'd have to listen to a friend, maybe your parents. Worse than that, you might actually have to visit a few different restaurants to decide which ones are actually good, because you can't look at the ratings online, because there are no connected information. That's what it was like before you had a smartphone. As you know, it's the search engine in your phone that's tracking your interests, that's looking at your data, and then directing you to where you want to go based on the interests that you have shown. That's an example of machine learning. That's an example of connected data. Our health system is a world tasked with much more complex, life-saving decisions than restaurant choices. And these decisions are made right now without the proverbial smartphone. This system is currently working really hard to shift from a paper-based service that still makes use of fax machines, yes, fax machines, to shift us toward an electronically based health record that is accessible anywhere across this province. A communication that connects data for patients wherever you receive service. This may be hard to believe, but our healthcare system was built in an era when their concern was about discrete patient instances. Whether you were a nurse, a technologist, or even a physician, you paid attention to that individual, and all of your information stayed there. It didn't connect. Systems were not connected. Machine intelligence was not leveraged. You graduates are entering the health sciences world with an expectation that information is connected. Information is accessible. That information will actually inform decisions. Your expectations are entirely appropriate, and they are necessary in healthcare. So, in spite of what your diploma or your degree or your certificate tells you you are skilled to do, your most important job, from my perspective, is you're a change agent. We need you in our healthcare system to move us forward. Today, even with our somewhat disconnected system, 75 to 80% of diagnosis is based on data. Those of you who are in medical imaging, laboratory medicine, nursing, forensics, you will apply your skills in your new vocation. But you're not only serving the patient and dealing with a patient experience, you are actually creating important information, data that will help that patient's treatment, and if appropriately connected, the data could lead to new treatment trends and treatment for others. Your expectation, your personal expectation that data should be connected and should be accessible is what will drive our system to get ready for the next wave of artificial intelligence and machine learning that will take our healthcare system to a new level. We're already providing virtual treatment for patients who cannot travel to hospitals or to a doctor's office. We have robots in our laboratories, and we are seeing significant growth in wearable devices or point-of-care devices that provide health-related information to people in situations outside of a hospital. But think about where this can go if those data points are connected. Think about the next wave of technology that will enable decision-making regardless of whether you're heard in Prince George and live in the Lower Mainland. Your data will be there for someone to take care of you because they will know your history. Think about a shift in healthcare that you could be part of that moves us from taking care of people who are already ill to proactively informing us all how to stay well. That is the change that the healthcare system is looking for. I believe this is possible, and I believe you are the people to get us there, because for you, this isn't even a leap of faith. This is what you deal with every single day when you're making your decisions. You're relying on connected information. When you leave here to start your new careers, remember that what you offer to the healthcare system and to patients who need your help to reach a diagnosis is the information you are creating, that you are accountable for. It helps to rule out other ailments, other issues that may be unclear on a face-to-face examination. It's not just your considerable skills in the work that you've been trained to do, but it's your understanding of what is possible in a truly connected world. In my experience, this is your real gift to us. So what are the closing words that I can give you? I have 3 messages for you. First, remember, regardless of what modality of training you are now skilled in, you are moving into a workplace that is purpose-based. Your aim is to help people understand their health, to improve their health, to possibly live a longer life. So when you have a rough day, and you'll have them, because healthcare can be a rough environment, remember your purpose. Remember that purpose. My second message is, remember you're entering into a workplace that is changing. Be the change. Be the change that your generation already holds inside you. Be proud of the information you produce. Take care with that information. Encourage new technologies that will make your job easier, faster, and more connected, because you already know that connected information is smarter information. Connecting information is going to change our healthcare system. And finally, my last message. Remember that if you can take this purpose of heart and be open to substantive change that's coming on the horizon, together we have the power to bring life to the quote that I'm going to share with you from celebrated Indian novelist and activist Arundhati Roy. Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. Lead us to that other world. Thank you.